33 seconds, someone dies from a heart attack in the United States. Heart attacks can present with chest pain, trouble breathing, profuse sweating. How are heart attacks treated?
Welcome back. Today we are taking on a tough topic, heart attacks. Heart attacks are incredibly dangerous, but unfortunately very common. Approximately 800,000 people per year in the United States experience a heart attack. In fact, heart disease is a leading cause of death for most people. It is estimated one person dies every 33 seconds in the US from cardiovascular disease.
Yikes, that's scary to think that every 33 seconds someone dies from a heart attack in the United States. What is a heart attack?
The medical term for heart attack is myocardial infarction, or MI for short, which in general terms means death of heart muscle tissue. The heart is essentially a big muscle that pumps blood throughout your body. Heart cells die when they experience ischemia or not getting enough blood flow. Blood carries oxygen and nutrients to maintain normal heart function. There are many different causes of heart attacks. For the purposes of this talk, we will be discussing heart attacks that are caused by decreased blood flow to the heart. This is the type of heart attack most people think about and see in the movies.
Recap. The heart is one big muscle that pumps blood full of nutrients and oxygen to our major organs. During today's talk, we will focus on the type of heart attack that is caused by decreased blood flow to the heart. How does that happen?
There are several major blood vessels that supply blood to your heart. These vessels are termed the coronary arteries. A heart attack occurs when there is a blockage of blood flow in the coronary arteries. Just like a pipe that becomes clogged in your home, blood flow to the heart can get clogged from cholesterol or blood clots. When a blockage of blood flow occurs, nutrients like oxygen can't get to the heart cells, which results in a heart attack if blood flow isn't urgently restored.
How do heart attacks present?
Heart attacks can present in many different ways. The most common symptoms of a heart attack include chest pain, usually described as pressure or heaviness on the left side of the chest, shortness of breath, nausea, and profuse sweating. That being said, sometimes patients, especially elderly patients and women, may present with less prominent symptoms, including only back or neck pain, fatigue, or even a sense of just not feeling right.
How is a heart attack diagnosed?
A heart attack can be diagnosed by an electrocardiogram, also known as an EKG test, which can check for abnormal electrical conduction in the heart and signs of a heart attack. Blood testing can also be done, like a troponin test, which checks for damage to the heart muscle. Other tests your doctor may order include a chest x-ray, a stress test, a CT scan, or a heart catheterization. A heart cath is where contrast dye is injected into the blood vessels surrounding the heart to check for blockages and need for emergency treatment.
Heart attacks are common and occur when some of the heart muscle dies. Heart attacks can present with chest pain, trouble breathing, profuse sweating, and other symptoms. Heart attacks can be diagnosed based on EKG, blood work, and a heart catheterization, which can visualize blockages in the blood vessels of the heart. How are heart attacks treated?
Heart attacks that are caused by blockages in the blood vessels in the heart are often treated by a procedure or surgery to restore blood flow, such as a stent or coronary artery bypass grafting. Just like a plumber removes a clog in your pipes, a cardiologist or cardiac surgeon can treat a blockage in the blood vessels. Heart stents are tubes that are placed in the blood vessels to open up a blockage and restore vital blood flow to the heart. Some stents also contain medications that keep the blood flowing and keep it from clotting. Coronary artery bypass grafting, or CABG for short, also known as open heart surgery, involves taking healthy blood vessels from somewhere else in the body and grafting them onto the clogged heart blood vessels, which can also restore blood flow to the heart. These treatments are usually given in combination with things like aspirin and blood thinners to keep the blood from clotting too quickly and causing a worsening blockage of blood flow. Not everyone is a candidate for these treatments, and a specialist like a cardiologist or cardiac surgeon can decide what treatments may be right for you.
Can the heart recover some of its normal function after a heart attack?
That's a great question. Sort of. The heart can compensate for a heart attack, and you can recover some of your normal heart function through exercise, a healthy diet, quitting smoking or vaping, and other healthy habits. Unfortunately, many patients that have a heart attack go on to die even with the best treatment. Other patients go on to have lifelong heart problems, including heart failure, which is where the heart's pumping function is decreased. Heart failure can limit your ability to perform many physical activities. That being said, some patients do go on to have a full recovery and live a normal life, especially if they receive early treatment and have a reversible cause of their heart attack. Your doctor can help you come up with a treatment plan to give you the best chance to recover after a heart attack.
It sounds like early treatment is key for a heart attack. Treatments include heart stents and heart surgery, as well as medications. Your doctor can form a personalized plan to help you recover after a heart attack. What are risk factors for a heart attack?
Lifestyle choices are a major risk factor for having a heart attack. Things like being overweight, eating an unhealthy diet, lack of exercise, smoking, heavy alcohol use, and hard drug use can put you at serious risk for a heart attack. Other conditions like diabetes, high blood pressure, high cholesterol, and family history of heart disease may also increase your risk of having a heart attack.
Risk factors include being overweight, eating an unhealthy diet, lack of exercise, smoking, heavy alcohol or drug use, high blood pressure, diabetes, high cholesterol, and family history of heart disease. Can heart attacks be prevented?
Heart attacks can't always be prevented, and they even occur in young, healthy people. Things you can do to lower your risk of a heart attack are to eat a healthy diet, maintain a healthy weight, get regular exercise, avoid smoking, and get regular checkups by your doctor. If you have diabetes or high blood pressure, making sure these conditions are being treated and evaluated by your doctor are also very important.
That's a lot of information. Let's recap. Heart attacks are when the heart muscle dies from not enough blood flow to the heart. Blockages in the blood flow to the heart can sometimes be treated with heart stents or heart surgery, but this should be determined by a cardiologist or a cardiac surgeon. You can help prevent heart attacks by eating a healthy diet, exercising, avoiding smoking, and getting regular checkups by your doctor.
Great summary. That wraps up our discussion on heart attack. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you're concerned about an emergency or a serious medical condition, please call 911. Keep tuning in for more information about common medical conditions, and don't forget to like and subscribe if you found our content helpful.